So Renew Hip is a solution for this active patient. Instead of replacing the entire joint with synthetic metals and plastics that are supposed to last a lifetime, we're just dealing with the damaged portion of the joint, replacing the anatomy and restoring the contours of the joint, but importantly, restoring the mechanics from day one, as you can see in this animation. And it's designed from the ground up to get these patients back to their active lifestyle as quickly as possible. And then over a period of 2 years, the implant is slowly replaced by functional tissues. And this is important because it preserves all future intervention options for this patient. So how do we do this? Well, we do it by combining two pretty special components in the manufacturing process. One is a 3D woven textile, which is really our secret sauce and got us started. The other is this true 3D printed layer, and the combination of which mimic the healthy tissues in the body and help us to replace the arthritic zones in the joint. And this is what I'm talking about as you have some inflammation, and inflammation inevitably leads to deterioration of the surfaces, and you have these defects and these deformities. And then we're able to restore that with our implant. And this is a key differentiator between us and other cartilage repair technologies, namely that we restore the anatomy and the contours from day one. We integrate with native tissues within 30 days, and then it absorbs to transfer that functionality to native tissues. And we've done the animal trials to show that this works. This is an animal study that we did in a canine model, and you can see the control, which the standard of care is used. This is supposed to be round, it's supposed to be spherical. You don't have to be a pathologist to understand this is a failure. And then if we look at Renew Hip here, we've maintained the sphericity of this joint at this 1 year time point. We've integrated with native tissues, and we've also transferred the functionality to the native tissues at this point as this implant is absorbing. And this leads to direct restoration of the activity levels of these animals. And you can see here, if we compare Renew Hip to the osteoarthritis control in terms of motion, pain, and restoration of activity, we were successful at 3 months of getting these animals back to normal. So a little bit more about this technology and the market that we're trying to address.